Great. Thank you so much for joining our Economic Mobility Alliance Ohio Benefits Cliffs 101 webinar. We are so excited to be getting started this afternoon and want to give everyone just a moment to come in from the waiting room. Okay, great. Thank you so much again for all of you for joining the Economic Mobility Alliance Ohio's first webinar, Benefits Cliffs 101. We're really excited to be here with you today to be able to talk about benefits cliffs and kind of dive into what does that mean and who in Ohio is impacted by cliffs and what's going on in the policy sphere and the policy sector that is really addressing benefits cliffs. I want to start off by saying I'm Sarah Hudasek. I'm the Coalition Manager of Advocates for Ohio's Future, and we're part of the leadership team of Economic Mobility Alliance Ohio. And you'll hear from so many of the leadership team members today. And I want to start by telling you a little bit about who Economic Mobility Alliance Ohio is. This has been a group and an effort that has come together after a few months of work and convening. And really, we're an alliance of state and local advocacy, research. There's workforce development at our table, health and human services organizations, some funders, and we're all committed to ending the system of disincentives to work that we all know as the benefits cliffs. And this is a term that I'm sure so many of you have heard before. Before you join this webinar, you'd probably heard the term benefits cliffs. We're going to dive today into what that term means. And really, Economic Mobility Alliance Ohio exists to bring together all of the work that's already happening across the state, all of the individual efforts across sectors, across geographic areas of the state, and really coordinate and work together and pursue shared goals. These are our leadership organizations: the Center for Community Solutions, the United Way of Greater Cleveland, Advocates for Ohio's Future, where I'm from, the Ohio Workforce Coalition, Ohio Means Jobs, and the Cleveland Cuyahoga County Workforce Development Board, the Greater Sandusky Partnership, and the Women's Fund of the Greater Cincinnati Foundation. And like I said, you're going to hear from so many of these groups today. And I want to start by turning it over to David White from the Greater Sandusky Partnership, who's going to introduce and kick off our speakers and kick off the webinar for us. So David, take it away.
All right. Well, thanks, Sarah. I really appreciate it. I have the distinct pleasure of introducing Holly, who's going to talk to us about what are benefits cliffs. And before I do that, I just want to kind of describe from our perspective, what is the impact of benefits cliffs to people that we serve, right? And so from the Greater Sandusky Partnership, we have what we call an employer resource network. And really with that, we embed coaches in our local businesses. And those coaches really are there to specifically help, really specifically help employees overcome barriers to work. And the benefits cliffs play a significant role in that. And so, quick 2-second story is, when we first kicked off the Employer Resource Network, we didn't necessarily know a whole lot about benefits cliffs. And we had a woman working at the local hospital. She was a certified nursing assistant, making what we think is a pretty good living, right? She was making about $2,000 a month. And because she was such a great employee, a great worker, she was offered a leadership role within the hospital, a management position. And that came with a $500 a month raise. And so, she was ecstatic initially when she, when she was offered this raise. But, $2,000 is tough, as we know, to live on. In the state of Ohio. She has 2 kids, by the way. And so she was receiving SNAP benefits and Medicaid and child care subsidies, and housing assistance. And when she realized really the implication of that raise, the net loss for her was substantial. Her SNAP benefits were reduced. She was no longer eligible for healthcare under Medicaid, and her childcare subsidy was substantially reduced. And so, although she received a raise, and she didn't, she was apprehensive about taking that raise, um and arguably, like, that she should have been, because she ended up with a net loss. Now, luckily, we were able to help her kind of navigate through that through some other programs, but that's the reality that our employees face. And so, with that, I know that was. I know Emily. I'm sorry, Emily is next. But Emily, I would love to introduce you, hand it off to you. I know you're going to talk about benefits cliffs and really the impact, but I wanted to share that kind of anecdotal story before I did that. So,
Great. Well, thank you. Good afternoon, everyone. Thank you for being here today. I'm Emily Campbell, the president and CEO at the Center for Community Solutions. And my role today is to talk a little bit about what are benefit cliffs. And the example that David shared dovetails perfectly with some of the information that I'm planning to share. So unplanned, but thank you so much for that real world example of how this plays out in the lives of Ohioans every day. When we think about the path from poverty to economic independence, sometimes when we're talking about career pathways and when we're talking about how it works to move yourself or your family from poverty to economic independence, we think about it as an escalator. You get on the path and you just have a smooth ride up. But in reality, it feels more like a roller coaster, which sounds a lot more fun than an escalator, but really is not for those who are living those circumstances. There are fits and starts, there are ups and downs. It is not a smooth pathway. And part of the reason that we see a disconnect between all of the investments, all of the amazing programming, workforce development, public benefits, investments by foundations, United Ways, and others to break generational cycles of poverty. We're not seeing those necessarily translate into population level changes of well-being and economic independence for the people within our communities. And the benefits cliffs are part of that reason. So benefits cliffs can be explained in hours-long webinars, and I'd be happy to provide one in the future. But if we can go to the next slide, at its base level, low-income families qualify for work support benefits that help cover the cost of basic necessities. But as earnings increase, the families begin to lose these benefits, or they're reduced, just like in the example that David shared. And the result is that people can earn more without improving their financial situation. And there are points on this path from poverty to economic self-sufficiency where it is actually not in the best interest short term of a family to work more hours, to accept a promotion and the raise that goes with it, or to find a different job. Now, theoretically, several researchers have found this to be true. And when we're thinking theoretically, some of the best work comes out of the Federal Reserve Bank of Atlanta. And in a report that they published in 2020, they said, and I'm going to read you the quote, "Career pathway programs may have limited success if participants ultimately have little short and medium-term financial incentive to advance, or if short-term financial needs prevent them from basing advancement decisions on the long-term financial gains associated with career advancement." The Atlanta Fed found that on every path in a healthcare career ladder, and every step in that path, the family would actually be temporarily worse off because of the value of benefits that they would lose as they continued to move up that path. Now, in the long term, every step was a net positive. But the short term is often where we have to think and live when we're talking about families that are struggling to make ends meet and making difficult decisions between paying for their basic necessities, paying their housing bills, or buying food. This also impacts employers, as David mentioned, and the Ohio Chamber of Commerce's Research Foundation found that nearly 1 in 5 Ohio businesses had experienced issues with hiring, promoting, or increasing wages for employees because of concerns that the extra income would result in the loss of some form of public assistance. So we're hearing it from employers. And the next slide shows an actual tweet. It was when it was still Twitter before it switched to X, from a regular working Ohioan who said, "I'm broke and always struggling, but with the number of conditions I have that require frequent appointments and intensive management and support, it's almost not worth it to stop being poor if I lose my care source, LOL." Of course, it's not funny. "I'm constantly terrified that I'll lose it suddenly." When this person mentions care source, they're talking about Medicaid coverage and their Medicaid managed care plan. And this person is not alone. We have heard it over and over again. Research out of Colorado, from Indiana, closer to home at the Cincinnati Women's Fund, in the Ohio Department of Job and Family Services Human-Centered Design work, have all found that low-income working Ohioans sometimes do take benefits cliffs considerations into account when they are making career decisions. And those can be very harmful for someone's long-term or a family's long-term economic perspective. So when we're thinking about benefits cliffs, I want to emphasize the 2 S's there at the end of those words. And the next slide indicates that we're talking about multiple benefits. There is not a public benefit program that we have found that under our model has absolutely no cliff, smooth sailing, you lose it, you keep going. We are talking about SNAP, which helps with the cost of food, Medicaid coverage for health coverage, the public housing and housing choice voucher program from the U.S. Department of Housing and Urban Development, TANF, or here, the Ohio programs here, and publicly funded childcare all create benefits cliffs when families earn too much to be able to continue on those benefits or have the same level of support coming from those public benefits. And there's multiple cliffs. So this shows a very pared down version of the modeling that Community Solutions has done, looking at a low income or going up to a higher income family of 3 with 1 adult and 2 children, and what that might look like. One thing that you'll note immediately is that benefits cliffs impact workers at higher wages than what we sometimes might think. This is full-time wages, and you can see there, this was completed a few years ago. Between $16 and $18 an hour is really a place where a substantial benefit cliff may be hitting this family, and then all the way up into higher wages. At the higher incomes, the impacts of cliffs are primarily due to the loss of Medicaid coverage for children and needing to purchase coverage on the marketplace or through your employer, as well as the design of Ohio's publicly funded child care program and the co-payments, which rise faster than what one would earn if you earned another $1 an hour per month. So sometimes there's co-payments that push people over their ability to make up any lost benefit with the extra dollars they are earning. Sometimes benefits cut off more abruptly. So some phase out, some end abruptly. Community Solutions is likely to be updating some of this information over the next couple of months so that it is available for advocates and others toward the end of the year. I will say that one thing in the policy realm right now that's impacting this particular line is the upcoming expansion of SNAP eligibility in Ohio up to 200% of the federal poverty level in terms of gross income. And so that'll move where some of these cliffs happen and how deep they may be for a particular family. But if you take nothing else from what I've shared with you today, please remember that we are talking about multiple benefits with multiple cliffs, and that this has theoretical impacts, it has impacts on employers, and it has impacts on families. And a lot of the solutions to these issues fall under policy. which leads us right into the rest of our webinar.
Thanks so much, Emily. Fascinating, and really appreciate you explaining benefits cliffs to us. The next person I get to introduce is Rebecca Kusner, who's the director of the Ohio Workforce Coalition, and she's going to talk to us a little bit about who is affected by these benefits cliffs. And so, Rebecca, really look forward to hearing your insights, and over to you. Thanks.
Thank you. And thank you to all of the folks who worked on this webinar. So as noted, I'm Rebecca with the Ohio Workforce Coalition, and I'm going to be talking about some work that we released that really gets to Emily's point about the cliffs affecting everyone, and talk about employers and what we know about employers across Ohio, particularly in frontline jobs. Really quickly, so next slide, Sarah. Really quickly, we have 3 policy priorities, and the cliff work fits under those. We are looking for support for individuals, businesses, so that they can offer good jobs, and equitable access to opportunity through workforce education and training programs. So you very quickly get to conversations about the benefits cliffs. Next slide. What we do to make sure that we are tackling our priorities is share information and best practices, some of what we'll do here today, gather a lot of input from workforce stakeholders, and gather and analyze data to develop and disseminate research about workforce-focused issues and issues that are tangential to workforce. And next slide, the report that we issued last year, When Working Isn't Enough, really looks at wages and public benefits in Ohio, looks at it with very specific focus on what is happening in demand industries or demand occupations across the state. And we actually worked with the Center for Community Solutions to produce the report. And I'm going to tell you about what we see and who's impacted. Next slide. So many of you, I'm sure, have heard this idea. There's been news stories, there's policy talk, there's this narrative that we are in a talent shortage because people are sitting home and not working because they're getting these great public benefits and they're just staying there. We started thinking about that and we're like, we just don't think that's true. We knew that there were a large number of individuals. Actually, the most recent data I have says 70% of individuals under 200% of poverty in Ohio are actually working. So we wanted to better understand who's accessing certain public benefits, document what that uptake looks like relative to some in-demand jobs, and then look at why specifically workers of color access benefits at a higher rate than white workers in many of these occupations. Next slide. So our report examined 10 in-demand occupations. We identified in-demand as high numbers of current employment, current openings, and growth projections. But we sort of narrowed them down looking specifically at occupations that have median wages likely to keep workers near a benefit cliff. You've got a list of the occupations we looked at right there, and we're going to talk broadly about some of the findings and share some slides and links for more information when you have more time. So at the very high level, and this is occupations beyond just the 10 we looked at, this is occupations with Ohio data available, 15% of all workers are enrolled in SNAP. And so that is a big number. Even more are enrolled in Medicaid. So we have this report focused specifically on SNAP and Medicaid. And again, just being clear that this data here is broader than the 10 occupations that we looked at. But I think if you think of high growth, high opportunity, high wage sorts of jobs, there's still a fairly decent percentage of workers clustered in jobs that have that keep them on public assistance. So the 10 occupations show us very specific findings, and we have them organized here based on highest growth potential, most openings, and highest current employment. So David mentioned home health or CNA sorts of positions. So healthcare, the home health aide is a demand occupation. There are a lot of openings. It is one of the first steps on a healthcare career pathway. It's also got the highest overrepresentation of Black workers. And you can see the numbers there. And the highest rate of workers who are receiving Medicaid. So if you think about the caregivers across Ohio, 42% of them are eligible and receiving Medicaid in those frontline jobs, and 32% receiving SNAP. And so heavy reliance, because those jobs do not offer wages and conditions that are going to help people transition from the cliff. As far as those jobs with current openings, you see some data. Lots of folks are surprised to see that there are manufacturing occupations that, depending on the size of a family, can keep people eligible for Medicaid and SNAP. Again, the pathways are really important. So looking at who has access to those pathways and how can we make sure that that access is equitably distributed. And then around the highest current employment, fast food and counter workers has the highest current employment, 120,000 openings across the state, and the lowest median income, second highest percentage of individuals receiving Medicaid, and third highest receiving SNAP. So the number of people that we're talking here who are working, who are showing up, who are paying taxes and still needing to cover basic supports is not insignificant. We go into more detail for each of these occupations, and we don't have time to go through all of those today, but this gives you a sense of, oh, you can go to the next slide, Sarah, sorry. This gives you a sense of the types of data, the numbers of people that are impacted by it, and the occupational segregation and what we see of representation for Black and brown workers relative to white workers. This is just an example from that's the healthcare support staff position. You can go to the next slide. Which is I think the food service positions. And then we also have a slide in here that focuses specifically on manufacturing. And we look at wages according to the percentiles, both hourly and annual wages. So specifically here, for example, 34,000 is the median annual salary for the sector, 1675 is the mean hourly wage. And looking at the impacts, even in what we consider a good manufacturing job, a single person with just one child earning less than 23,000 would be income eligible to receive SNAP. And so you still see this persistence of reliance on public benefits. Next slide. But what we want to say is, where do we go from there? We want to acknowledge that receiving public benefits is not a proxy for not working or not wanting to work. So combat that narrative around people are sitting home and not working. They are working. We want to also increase the conversation, as far as who's impacted by cliffs. As Emily mentioned, employers are impacted by cliffs, but there are hundreds of employers across Ohio that offer jobs that force workers to have to access public benefits. And so there is a role for the private sector in addressing the cliffs. And, certainly occupational clustering, as we talked about, uptake of public benefits, occupational clustering in low wage jobs is important to consider when you talk about higher rates of public benefit use for Black workers. And then, as I mentioned, employers impacted by the need for talent, difficulty finding talent, difficulty promoting talent, really need to also be thinking about what role they play in this solution relative to the quality of their jobs and the quality of their workplaces. So employers, business, workers really impacted, and then of course, individuals wanting to enter the workforce as they're thinking about which pathways. So I'll drop some links into the chat. Want to wrap up here to keep us on schedule. You can email me, you can call me, happy to talk more. There's a lot to say about this, but really encourage you to be thinking about the individuals, the employers, and then the impacts on the overall system that we're thinking about relative to addressing those cliffs. Thank you.
Thanks, Rebecca. That was really informative. So next, I get to introduce Melanie Hill with the United Way of Central Ohio, and she's going to talk about ALICE workers, which stands for Asset Limited, Income Constrained but Employed. She's going to talk about some of the challenges they face, because as an employer, we say, oh, well, I'm paying $18 an hour. That's a good wage. But we know, if we look at the MIT living wage calculator as just one example, that a single mother with 2 children, or a single parent with 2 children, in order to pay and make all ends meet from food, childcare, medical, housing, etc., they need $42.22 an hour. And so that's a substantial gap there. So anyway, Melanie is going to discuss kind of what benefits cliffs mean to ALICE workers and some of the data that's come out of the United Way Central Ohio.
Thanks, David, and good afternoon, everybody. I'm really excited to be here. Again, I work at United Way of Central Ohio, and I also serve as the state rep for the ALICE body of work here in Ohio. So today I am excited to share a little bit about the report. Just because the time is short, I'm sharing some high-level data, and I'm just going to highlight some things from the ALICE website that I think are relevant to today's topic. So I'm really hopeful that by giving you a glimpse of this data and what's available on the website, that you'll be compelled to do some further exploration on your own time. So like David said, a brief explanation of who is ALICE. What is ALICE? That is an asset limited, income constrained, employed person. And so it's families and individuals that are often hidden in plain sight, who earn above the federal poverty level, but not enough to afford basics. You can look at the pictures on this slide and see it could be a childcare worker taking care of your preschooler, or a healthcare worker at a nursing home. It might be the local cashier at the Home Depot, or a guy driving a forklift in a warehouse. In Ohio, between 2021 and 2022, the number of households in poverty increased by 17,000 and some change, and it went up from 13 to 14% of all households in the state of Ohio, while the number of ALICE households increased by over 26,000 households, but it still remains flat at about 25%. In the report, what you'll see is a graph that demonstrates how the poverty line has remained relatively flat over the last 10 years, but the ALICE population, those folks that are working but still struggling, that has risen steadily and increased by 7% between 2010 and 2022. We can go to the next slide. I want to talk about the household survival budget, and that reflects the minimum cost to live and work in the current economy. So this is the basis for determining whether a household is above or below the ALICE threshold, and it's at the county level. Just FYI, counties serve as the base geographic unit of analysis because that's the smallest jurisdiction for which there's reliable data across the country. So ALICE data is available all across the country, and you can go to the ALICE website and click on any state and get some information. There are partner states, which Ohio is one of the partner states, and there are, I think, 33, maybe even more states than that are partner states, where they produce reports which provides a lot of in-depth information at the county level. And it's updated on an annual basis now. So the numbers that you see here are the total number of households below the ALICE threshold. So that includes both ALICE and those folks living in poverty. And in Ohio, in 2022, which is the most recent data that we have, nearly 40% of the households are struggling. So if you just think about that, it's kind of mind-boggling that nearly half of the households in our entire state are struggling to get by. There's something wrong. And as we know, as we've heard about the benefits cliff, we have to do something about it. If you go to the next slide, this is a really helpful visualization. I think the ALICE body of work and data, it aligns well and is is a wonderful tool and supplement to help further the conversation and demonstrate the need to address the benefits cliff. So this visual right here shows the breakdown of costs and wages in our state. So you can look at the two bars and see that the costs went up from 2021 to 2022. That's the blue bar. And then even though wages increased, it was still not enough, even with some of the tax credits, which you see represented in green on this bar graph. So 2021, I think in 2020, there were a lot of pandemic era benefits. So there were stimulus payments, extension of tax credits and whatnot. Those things helped, but you can see here, it still wasn't enough to get people over that edge. So, and then as those pandemic benefits fall away, we're really starting to just see very clearly how wages are not keeping up with the costs of living. And then I don't even want to talk about the federal poverty level. You can look at that bar on the right and see how obsolete it is. And I think the previous presenter mentioned how we're using 200% of the federal poverty level now to determine eligibility for certain benefits. So it's just become obsolete, and the ALICE metric is a lot more useful. So if we can go to the next slide, I'm going to try to go quickly and just highlight a few things that are available on the ALICE website. One of them is the ALICE wage tool. So this is dynamic. This is a screenshot right here where you can pick the state, and then there's a slider and you can select the hourly wage. And I think on here, I can't see it. My screen is too small, but it might be, I don't know what the number is on there. It's $20 an hour. But the blue highlighted counties show where that wage is high enough to support a household survival budget for a family of two with one worker and one child. You would have to slide that slider up to $25 an hour. It's $24 an hour and some change in order to get all of the counties in the state of Ohio blue and up to a livable wage. So that's just a dynamic and helpful tool. If you go to the next slide, this one is really helpful, especially if you're doing advocacy and policy work. This is a legislative district tool, also dynamic. I just randomly picked one of a legislative district, and you can click on it and it'll give you a snapshot of what the population looks like in terms of ALICE. So you could see broken down by different demographic groups who might be experiencing ALICE and poverty at a disproportionate rate compared to that whole population. And then you can also see what percentage of folks are using SNAP benefits. And so that can just maybe offer some insight. It may be a great conversation starter. We have shared the ALICE report with all of the state legislators. So I can't guarantee that they've all looked at it and read it, but we know that some of them have because we got some feedback. But everybody all of the legislators in the state have at least received this information. So if you do advocacy work, feel free to share it with them again or refer to it and see if folks are using it. And then if we go to the next slide, and we'll go to the next slide too. I want to spotlight, these are a couple of call outs from the latest ALICE report. It was called ALICE and the Cross Currents, an update on financial hardship in Ohio. They did want to highlight in that report, spotlight on families, ALICE families with children. In 2022, 32% of families with children in Ohio were struggling. That's a lot of percentage of families, but if you go look at the report, you can dig a little bit deeper and see that certain family types are experiencing ALICE and poverty, worse than others. So 74% of single female-headed families and 48% of single male-headed families were struggling in 2022. So that's contrasted by only 13% of married parent families that are struggling. So on the surface, 32%, you may or may not think that's a lot of families, but then when you take a closer look and you break it down into these different family types, 74% of single female-headed families are struggling. That is pretty striking. And next slide. Another group that is struggling, older Americans. So that is a fastest growing demographic from 2010 to 2022, with a 28% increase in the number of those households that were falling below the ALICE threshold. So these folks, many of these folks are dealing with that by working well past retirement age. So it's, it hits everybody. And if you go to the next slide, this is just the website is unitedforalice.org. And we didn't have a time to dive into it, but I hope that this has sparked some interest for you, and that it can be a useful tool to supplement and advance the work that you're doing to address the benefits cliff. Thank you.
Thanks, Melanie. That was really great. Those tools seem incredibly helpful. It's crazy to think that $24 an hour is a living wage for a 2-person family, 1 adult and one child. So the next person I get to introduce, really excited to hear her talk, Holly Hankinson, who is the Advocacy Director with the Women's Fund of Greater Cincinnati. And she is going to talk about what are other states doing to address some of these cliffs. Certainly not just a state of Ohio issue, but a federal issue. But then what have we done at the state level within Ohio to start to address these cliffs? And how does that align at a high level with the Economic Mobility Alliance of Ohio's initial priorities? So Holly, I hope I didn't give you a panic by almost going out of order, but over to you. Thanks.
Thank you very much, David. Nope, I was fully confident that Emily was going to jump in and take it earlier. So thank you so much. Yes, hello, welcome. Thank you, for being here today. As David mentioned, I'm Holly Hankinson. I'm the Advocacy Director for the Women's Fund of the Greater Cincinnati Foundation. And I'm going to talk a little bit about where do we sort of go from here? How do we address these issues that have been so eloquently laid out by our presenters before? So, as you can imagine, based on, the outlining of the issue, this is a really complicated scenario. It's a really complicated issue that people face. And one of the biggest barriers is, that there are so many levels of government involved, so many different programs that impact people. So this is really a challenge in how do we address it? How do we address these challenges? And so even though this is a complicated issue, there are many states, as David mentioned, around the country. This impacts every state in the country. This isn't unique to Ohio. And there are some states that are making progress, that are trying to address this issue head on. And so as we think about where we go from Ohio, and as we created this coalition and made recommendations, we really started by looking at what other states have done and what's been successful there. And what are their approaches? Go to the next slide. So as I mentioned, a lot of states have done this work. I'm not going to list out every policy that's been implemented in every state across the country, but there are, as we look, some themes that have risen of the types of interventions different states have used to address this issue. So here's sort of some of the common themes. First, there is, increasing the eligibility threshold to receive the benefits. This is sort of across, childcare, SNAP, all of the different benefits that we receive. We need to increase these thresholds. It's one approach the different states have taken. And as you could see from Melanie's presentation, even the thresholds right now are pretty low to receive benefits, and people are still struggling even when they don't meet those requirements. So if we raise the threshold, more people will, who are sort of struggling to make ends meet, will be able to access those public benefits. The second theme we see in other states is, establishing more transition periods or tapering off of benefits as income rises, to make sure that when people receive wage increases, they are receiving more at the end of the day rather than falling off that cliff. This is the one that most directly impacts those cliffs that we saw Emily outline before, sort of smoothing out those cliffs. The third is increasing the level of permitted assets to determine eligibility. A lot of the programs that are public benefits don't allow families to hold on to any assets or very, very limited assets to have that sort of safety net or sort of basic cushion in case an emergency happens. The amount of assets individuals are able to hold and receive benefits is really limited. So some states are increasing that level of assets that they're allowed or changing the categorization of different assets to calculate eligibility. The next is some states are expanding their earned income tax credit at the state level and making it refundable. This is really simple because it just provides more cash in the hands of pockets of people who need it most. So this is a direct funding that's, not constrained to a certain category of item. It's just putting money back in pockets of people who need it. The next, we see a lot of pilot programs around the country, cliff effect pilot programs from different counties, really to try and figure out a holistic approach at the smaller level and then expanding out from there. So that's a really popular approach. And then finally, creating calculators and coaching tools for families to understand when those cliffs are coming and how to plan for cliffs or losing benefits, tapering off benefits before they happen, sort of better prepare families as those cliffs approach. So again, I'm not going to list out all the states that are doing this. I just want to highlight a couple of different places that are leading the way in benefits cliff policy. The first is the state of Colorado. Since 2014, Colorado's really expanded their benefits to address the cliff. They've focused on childcare, a lot of their efforts around their childcare system. And they also had a cliff effect pilot program that has since been expanded to cover the entire state of Colorado. They've also done things like raising income limits for Medicaid and CHIP and created rules to increase access and flexibility to other benefits. The other place in the country I want to highlight is New England. So in New England, there were 6 states that came together to create under this effort called a whole family approach to jobs. It's a regional effort that focused the solutions on sort of the 2-generation solutions. So instead of looking at just children or just workers, they really looked at families together to create solutions. Maine in particular is one that really focused on breaking down these agency silos. So allowing the 8 different agencies to talk to each other and share databases and best practices. They also created a cliff dashboard with the calculator and tools to identify the cliffs. And they did a lot of other things to sort of address this issue. And I think the point I want to make of raising these 2 locations in particular is in each of these states or regions, they really did a lot of different things all at once to address this issue, which is, I think, an approach that works well is when really they're not just taking one policy or one program, they're really looking at how do you support a family across the board. So that brings us to Ohio. So what are we doing in Ohio? Ohio has really has been interested in this issue in recent years, and we've seen it through policies and the administration and the legislature to really start to address this. So in 2022, there was created the Benefits Bridge Pilot Program using TANF funds. And this really was at the county level. They began with 6 pilot counties to look at, to help Ohioans get past benefits cliffs. So they provided success planning, financial wellness, and sort of supportive services and other work supports to help workers stay employed as they go over those cliffs. Another thing that Ohio has focused on in recent years is our publicly funded childcare system. So starting, I believe, it was in 2016, they increased the threshold from 200% to 300% maximum eligibility, and they began increasing the minimum threshold for eligibility for publicly funded childcare from 130% up to 145% now. And there's currently a childcare choice program that increased eligibility to 200% FPL FPL, sort of in a short term. I believe that's a 1-year program. And then finally, just this past summer, the Ohio expanded its off-ramp for SNAP from 130% to 200% FPL and gross income to allow more families to access SNAP. So that brings us to our policy recommendations from our coalition, Economic Mobility Alliance Ohio. When we started to look at these, we really, again, started looking at the variety of different recommendations or policies that happen throughout the state. And then we started to look at what might work in Ohio, and we categorized them based on sort of what some goals might be for how do we address these, how do our policy solutions fit into these sort of buckets. So the first bucket of recommendations are recommendations that would mitigate and eliminate benefit cliffs. So these are all recommendations that would mitigate those cliffs, those points in time where there's actually, you lose benefits, or you are in a worse financial situation than before the cliff. And also recommendations that would improve those core operations in our public benefit program. So these are things like improving the administration of benefits, that's by implementing changes that center the user experience, addressing revolving door challenges of sort of that churn of people losing benefits and then getting back on them, sort of that redetermination period that impacts so many families in Ohio. Increasing the minimum benefit level for SNAP for older adults and Ohioans with disabilities. Publish outcomes from existing benefit cliff pilot programs. So really leaning into those pilot programs and trying to see what works and then expanding that across the state. And then addressing the benefit cliff within Medicaid waivers for Ohioans with disabilities. So these are all things that really address those cliffs specifically. The next sort of bucket of recommendations that we have are those recommendations that reduce disincentives to work that are currently present in the public benefit program. So the first is increasing the Ohio Works First cash assistance eligibility level to 100% FPL, which, as we know, is still quite low. Right now, it's actually at 50% FPL. So by limiting individuals to 50% of FPL, that really limits preventing full-time employment to receive that assistance. So this, by increasing it to 100%, would allow individuals to maintain that benefit while increasing their working hours. The second is strengthening the prevention, retention, and contingency program by sort of adding one-time emergency funding to prevent that financial crisis. Things like creating job retention incentives and transitional payments to those leaving benefits programs. So making sure that program is expanded. And then finally, implementing or increasing that earned income disregards in Ohio Works First, SNAP, and Medicaid. So that would allow temporary income increases for individuals, seasonal overtime, for example, allow people to have those scenarios and maintain their benefits. And then finally, we have a bucket of recommendations that would truly create a pathway to economic stability for families. So these are, benefits that really allow people to earn more money and get ahead and work their way off benefits in sort of a true way. So we have recommendations around increasing that publicly funded childcare minimum eligibility to 200% FPL permanently, and make deeper investments in childcare infrastructure. We know childcare, the whole system is challenged right now, both with access and with publicly funded childcare thresholds. So really investing in that. Expanding childcare and Ohio Works First eligibility to include kinship caregiver families. That's another one that would impact childcare and others. Adopting a refundable working families tax credit or earned income tax credit in Ohio. Currently, we have a non-refundable earned income tax credit. So making that refundable would really just help our lowest wage workers. Creating employer incentivization programs or tax credits to invest in those worker supports. So getting the private sector involved, allowing the private sector to implement programs that would support their employees as well by providing incentives for employers to do that. And then finally, supporting the childcare and direct care workforce. We know that they are one of the lowest paid workers, some of the lowest paid workers, and they need support, directly and, indirectly through sort of supporting their training, their wages, and then also many of them are eligible for benefits as well. So those are our recommendations from our coalition. I know that it's a lot, and like I said, I think our goal is not that we're going to wave a magic wand and have all of these recommendations implemented tomorrow, but really we want to look at it holistically and provide a list of recommendations that we can rally behind and push forward. As it becomes viable for things to move forward over time. So with that, I will turn it back over, I believe, to David.
Thanks, Holly. I really appreciate it. And I think, part of what the Economic Mobility Alliance of Ohio's mission too is to educate. And so I'm super thankful for everyone that jumped on this webinar just to listen, learn, and help us build a coalition to talk about why these things matter. So I think Sarah mentioned at the beginning, if anyone has any questions, please drop them in the Q&A box. But I'll kick off the first one for Emily, and then please, panelists, if you have anything to add, feel free to jump in. But there was a question in the Q&A box that said, is there a conversation about adjusting public benefits eligibility to not use the federal poverty line since it is not representative of the financial needs of households? So Emily, over to you.
Sure. Well, so as Melanie so eloquently explained, the seeming irrelevance of our federal poverty thresholds and where those lines are set, there's overall general agreement that it doesn't reflect what a family would need in order to make ends meet and get by. Now, given that, what has happened is for these benefit programs to adjust their threshold up so that we're seeing up to 200% of the federal poverty level, up to 238% of the federal poverty level if we're talking about the state children's health insurance program or Medicaid for kids, moving that threshold up to be several times. Now, an interesting thought process is something that actually was brought up many years ago on the TV show The West Wing, which is changing the way that the federal government measures poverty. So the Census Bureau for many years has been looking at a supplemental poverty measure that is better reflective of some of those financial pressures for families. Say that the federal government were to adopt a different federal poverty level, I believe that all, if not most, of these public benefit programs would automatically adjust to that new threshold. So that if it went from, around $23,000, $25,000 for a family of 3 or 4, if that was adjusted upwards toward closer to what the ALICE threshold might be at the federal level, everything else automatically moves up. But that is a conversation for a different day and not something that's being discussed, to my knowledge, in the State House or in Congress.
All right,
Thanks,
thank you,
Emily.
Emily. Yeah. Hi, everyone. I'm Jason Kluk-Barani with the Center for Community Solutions. We have another question from the Q&A. Have work incentive programs and gradual reduction been effective in reducing the impact of benefits cliffs?
Well, I can take a very quick stab at that one again, and then I might turn it over to Holly very briefly. So the gradual reduction certainly does have an immediate impact on benefits cliffs. And as you heard, some of the things that other states have done, that's what we're talking about, is changing the benefit levels. Work incentive programs is an open question and really depends on the design of work incentive programs. Under some different kinds of work incentives, going directly to employees can be temporary and can count as income. So it can make some of these cliff issues worse or make it as though they're earning too much money. And so the design is very important to consider it. This is an area where we've seen quite a bit of progress over the last couple of years in working with and talking to employers and building understanding of how some of the things that they're hoping to do to help their employees may not be as helpful as they thought. Providing bonuses, doing some other temporary things, and the impact that some of those things can have on their employees' ability to make ends meet. So I'm quite hopeful those conversations are getting some legs, and I think we have some opportunity to make some real progress on that front. Holly, was there anything else on that?
I don't think so. I think you nailed it.
Holly, then maybe I'll start with you for this next question, and then again, Rebecca, Emily, Melanie, if you have anything to add, please do so. But another question was, we talked a lot about legislative pathways to maybe being a part of addressing some of these challenges. Do legislators even know about these benefits cliffs?
That is a great question. I think that legislators as a group are more diverse than, we can, can't lump them all together. I would say, yes, I think that some legislators certainly know, many of them are certainly aware of this issue. When we started talking about this from the Women's Fund back in, 2016, a lot fewer were aware. I think we were bringing it to them and they were like, we didn't know about this for the first time. I don't think that's the case now. So I think that more and more legislators are aware that this is a challenge. I think that the solutions are now sort of where things are complicated because it's such a complicated issue. It's not just a state level policy issue. The federal government manages many of these programs. They come down to the state, and then the state has their own sort of regulations and rules on top of those federal programs. And then it goes down to the local level, and that happens again. So I think that it's not necessarily that legislators aren't aware. I think it's challenging to understand sort of the impact and what's possible at the different levels of government.
Now, that's one reason that we have the Economic Mobility Alliance of Ohio formed, because there were lots of conversations happening in lots of different spaces, and recognizing that there's some opportunity here to advance those conversations and to pull together an advocacy agenda to address that would, if enacted, address many of these issues.
Well, that makes a ton of sense. Thanks, Holly and Emily, both for that insightful answer. Kind of last call for any questions for our panelists before I kick it over to Jason to kind of close us out, and Sarah, of course, for any final comments.
Well, hearing none, just wanted to say thank you to everyone presenting today, and thank you for everyone attending. We'd like to stay in touch with you and for you to learn more about the Economic Mobility Alliance Ohio. So we encourage you to explore our website and sign up to receive updates on future webinars and calls to action and anything else that Economic Mobility Alliance has going on. And I'll drop these links in the chat as well. And if you have any questions at all for us, please feel free to reach out. You can use that link there on the slide, and these slides will be sent out along with the recording of this webinar. And just thank you again. Sarah, is there anything else you'd like to say?
No, thank you so much. Hope to see you again soon. Bye, everybody.
All right.